Hey, Henderson County, it's good to be with you guys again. We've done two other meetings like this, and we wanted to get together again and just kind of visit about some of the medical issues that surround COVID. And I'm Doug Curran. I've been around here for 100 years and past president of the Texas Medical Association, and really love this place. Henderson County is just really special to me. I've raised my family here and really care about what's going on here. And I want you to know we're trying to do these things to provide you really good, accurate information that you can use to protect your family and make our citizens, our community safer. I'm really privileged tonight to have Dr. Chris Johnson with us and Dr. Jim Bob Qualls and Dr. Alice Splinter. And this group of physicians, we're going to try to visit with you just a little bit about what's going on in Henderson County and what's going on with COVID in our county. It's certainly the greatest healthcare crisis that I have seen in my 40-year career. And Dr. Mendenthal and I have been serving in a federally qualified health center that we're going to use for training family medicine residency in. And when we were having this conversation about COVID, we were both kind of, well, we got to get back in the game a little bit. I mean, the greatest crisis in our lifetime in healthcare, and we've been on the sidelines. So it's been exciting to be back at work a little bit and see patients, but it also has been really stressful because it's just hard for all of us. And trying to sort out what to do and how to do it has been a real challenge. Well, I want to throw some numbers out, and then we'll kind of go from there. Right now, we've got a little over 500 cases in Henderson County, and we've seen that number go up significantly. If you look at the graph, that number is on the rise a significant amount. And that number is probably a combination of additional testing, but it's also the fact that we're out moving around a lot more. As I've traveled on the road, there's just a whole lot more traffic than what I saw about a month ago. So we're just seeing a lot more activity. So we're going to see more COVID. We're just going to get more exposure. We're seeing that now. So we're seeing a significant rise. We've had 7 deaths of citizens in Henderson County from COVID. And, our hospital has some active COVID cases in it as we currently are experiencing. We have a lot of people in Henderson County that have illnesses and problems that set them up for COVID infection. So why don't we kind of begin by just visiting about what's going on at the hospital. And I know Jim Bum, you and Chris both have active patients and that you're caring for in that environment. Tell us about what's happening at the hospital. Go ahead, Chris.
The hospitals really had an increase in the number of active cases that were, caring for in the hospital. The number of positive cases in the hospital has been around 8 to 10 for the last week. We've had 3 or 4 people in the intensive care unit. So the acuity of illnesses in the hospital has really gone up a lot. I would say it started going up probably about 3 weeks ago, and we're still caring for a lot of really sick people in the hospital, mostly adults. It fortunately has not affected our pediatric population much at all. The therapeutics that we have here are outstanding, but there's still limited things that we can do for patients that have the disease, but certainly there are some things that we can do now that we're learning more about the disease in the process. We're doing some new therapeutics here at the hospital that's certainly helping people, and so we're excited about that.
Have we got bed capacity? Where are we with that?
We are fine as far as bed capacity at our hospital. Tyler is not in good shape as far as intensive care, but our hospital as well is in good shape. The hospital system has been very helpful in that we are sharing resources, and some of the other East Texas hospitals have been able to help when, you know, we needed to transfer a patient. They had capabilities that were able to help in that capacity. So it's been a real collaborative effort.
I heard we'd had some transfers in from other places to our hospital.
Right. Yes.
So
We've been able to do that, and we've been able to transfer patients from Athens elsewhere when we needed to do that. So it's been really nice.
yeah, it's good to see docs working together and not too territorial. Makes things a whole lot better. Uh,
Absolutely.
Jim, why don't you mention some visit just a little bit about the patients that are really at high risk for COVID because you know the vast majority of them are just going to have a little, probably a minor sort of sore throat, congestion, cough, so forth. Uh, what what do you got to watch for? What are the dangers?
Sure. The elderly population is the one thing that we're really concerned about. Also, people with any underlying conditions that can depress the immune system are also concerning. So you're looking at things like diabetes, heart disease, anybody with any pre-existing lung conditions, COPD, asthma. Those are the ones that are really the ones that, as far as I'm concerned, when I'm seeing patients in my clinic, those are the ones that I'm really trying to educate about COVID and the repercussions that COVID could bring upon them.
I was talking with a colleague, and she has two kids that both have asthma, and I know she was really nervous about COVID and what could happen with that. And I know in Henderson County, just Texas Medical Association, we'll put this up on the Henderson County Now website, but Henderson County per se has about 54+% of its population has one of those chronic diseases that you were talking about. And so that makes our populace at high risk. And so that's why we even need to be more careful about the basic things that we need to do. What are some of the basic things that you can do to protect yourself and your grandparents or your parents or whomever? I mean, what should we be doing out there to really protect our people?
Yeah, I think me and Chris were talking about it earlier. I think the main thing is if you can stay 6 feet apart from people, that's the number one thing that you can do. Now, I understand that you can't do that in regular daylight. It's impossible to do. So, I'm a big proponent of wearing a mask. If you know that you're going to be within 6 feet of somebody, then put a mask on. And I know there's a lot of controversy that is on this mask mandate or this recommendation, but I look at it as this. Fortunately, I'm young and healthy. However, I could be carrying COVID around and not know it. So in my clinic, I'm wearing a mask when I'm seeing patients. I'm wearing a mask when I go to the grocery stores. I'm wearing a mask if I need to get out and go take care of something where I know I'm going to be around other people. And not really for me. I'm doing that so that I don't spread COVID to somebody else that's part of that 54% in Henderson County. So I look at it more as a service to my community to wear a mask rather than to protect me.
We are our brother's keeper, and it's okay. That's what we do. I've gotten to where I just put this on in the mornings. It's just part of getting dressed. I just hang the thing around my neck. And I do think it's gotten politicized rather than really healthcare. This is about healthcare. We're just fighting a battle with the virus, and we're going to win that battle. It's just how much collateral damage are we going to have while we're getting there. And I think if we can just continue to do the things you were talking about, I mean, wash your hands 6 feet apart, wearing your mask. Those are just simple things that we ought to do. And I think you're going to hear us. It's just like what we tell people. How many of our patients do we tell them, hey, you got to quit smoking? Hey, you need to lose some weight. Hey, you need to exercise. We're going to do the same thing for now. We're going to be telling you, hey, you need to wear your mask. Hey, you need to wash your hands. You need to stay 6 feet apart. And I don't know about you guys, but I've gotten to where I think about it when I get in an elevator or somewhere where I have to go. I haven't gone very many places like that lately, but I got on an elevator not too long ago, and somebody got in, and I got way in the back part of that elevator over in the corner. And I had my mask on it, but it was just sort of like, well, wait a minute, my family's different, but I just felt. So I think if you just kind of get that in you, then you kind of begin to do those things that really will make us so much safer. I think the other thing that all of us are really worried about is we're kind of trucking along, and we're moving into a time of year, in addition to, are we going to have football? I think everybody's worried about some of those things, and now we're getting ready to start back to school. And how is school going to go? I mean, what do you think? What are some of the things? What are you guys hearing in the community from, Alice? What do you're seeing kids all the time. You're seeing moms and dads that are bringing them in, and grandparents. Uh, Tell us where we are. Tell us what you think about what AISD is getting ready.
So I know with AISD right now, their current plan is to do telemedicine teaching or the teaching online at least for 3 weeks, and then after that, the parents are um, sent a survey to decide how comfortable they feel about having the kids back in person at the school, or if they just want to continue to do the online teaching. They right now they have some good protocols in place about screening, as far as kids getting on the bus and making sure that they don't have a temperature before they get on the bus. They have minimal exposure as much as possible at the schools where there's not a huge crowded space of teaching, and they're limiting things like their PE. Like for PE, uh, they have a limited amount of kids at a time. Um, but I still think that for school, I think the masks are crucial. If we can have parents work with their kids and explain to them how important wearing masks are, and doing, hand hygiene are going to be crucial to help not spread it amongst each other and then bringing it home to infect the other.
I saw a piece not too long ago on South Korea, who's been really effective in managing this virus. And in their classrooms, the kids were almost all wearing masks, and they had a hand washing stations in the back of the classroom, and they've really done a good job of being able to manage it and get their kids back into school. And I don't think there's any controversy about uh, it's good for kids to be in school. I mean, just to be around it. We are creatures that like to be with other people. I mean, I love being with you guys. Besides, you make me feel younger. You guys are all pups, so make me feel better just to be around a bunch of young docs that are going to take care of our people for a long time. But I really do think that it's going to help our kids to get back in school if we can. But we got to do it right.
Right.
You know,
We need to have good access to testing,
right.
because with some of the requirements that they have right now, um, about the kids being able to go back to school, um, are having testing done. So we need to make sure that people have easy access and know what options they have and what places they can go to get tested.
And we were talking about the other thing earlier that we were visiting as we were just chatting. We were talking about the spread of it, and Chris, you were talking about kids and lung development and that spread back and forth. I'd heard differences in viral load, but you were talking some about that. Why don't you share
Yeah,
that
sure.
information? I thought it was really good.
The data on kids as far as transmission suggests that at age 10 and under, those kids, even though it's possible to get it, the risk for that age group is really less than the adults. And then, so your 10 and up are going to be more like adults as far as their risk factor. And so I would, reassure the parents that have children that are age 10 and under, that they probably are okay to go back to school and do it safely, but it certainly is an individual family decision. If you have a family that has a multi-generational household like Alice was talking about, where there's grandparents in the home, or maybe the parent has a chronic health condition that we were discussing earlier, their immune system is suppressed or something like that, well, those families may want to um, choose to continue doing online if they don't feel comfortable. But for the majority of our families that uh, aren't in that situation, um, I would encourage them to get the kids back in school and to do it safely. As far as the lung development, there are receptors in our lungs for different things, and one of those receptors is called an ACE receptor. And at age 10 is when the lung capacity becomes more like the adult, and the number of those receptors becomes more like the adult. So that's the thinking of why um, the 10 and under are less susceptible than the over 10, but that's still somewhat theoretical too.
Sure. And Alice, I mean, she brought up a great point earlier. Just because the guidelines, I think it's 11 and above or middle school and up for masks. If you have young children that'll wear a mask
Yeah.
in elementary school, send them to school with a mask on. I think that's important.
And I think as we become more accepting of it, our kids will become more accepting of it. So I think it's just like other behaviors that we model for them. Wearing a mask is no different. And if we can teach them how to use that, I mean, we teach them how to do all the other stuff. They learn all of our bad habits. We can certainly teach them some of our good habits as we kind of rock along with things and show them how to use a mask, how to put it on when we separate or when we're out playing baseball and we're way apart, then you don't have to wear it. You know what I mean? Just kind of teaching it as we work with kids in doing it. But somehow we got to get past this idea that that again, this is anything other than a virus that we're trying to take care of folks and manage them. And I think I would encourage our populace, if you have questions about what's going on, why is it we're doing this way or why are we doing that, talk to your personal physician about it. Just sit down and have a conversation with Dr. Johnson about what he's doing and why he's doing that. Or why should I do this? I'm real frustrated. I'm tired of being in all the time. I really don't want to wear a mask. I don't want to fool with all that stuff. Why should I do that? Are you guys, do you sense that in the community?
Yeah, I think there's a lot of confusion in the community. Um, but like we've kind of already talked about, I mean, I think social distancing works. I think wearing a mask works. And I understand a lot of people. This has been going on since really March, and a lot of people are tired of being quarantined. They're tired of not being able to go to family functions. They're tired of not being able to see family. And I know that's a big stress on a lot of people. I mean, the number of anxiety cases that we've had come through the clinic, y'all would all know, is going up because of all this. But keeping your social distance, if you're going to have a get together, be smart about it. Plan ahead. Have an outdoor gathering. Have tables set up for family pods. You're outside. Wave to each other. We don't need to shake hands. We don't need to come in contact. Have a way to serve the food to where not a lot of people are in a buffet line to do it. I think some easy planning here can go a long way to safely being able to to do what we're born to do, which is socialize.
I know a lot of people have been really frustrated because, especially during the summer, is time that you do things like weddings and vacations, and so a lot of people are very frustrated about the plans that they had. But I think people just need to look at it long term. That for the benefit of the whole society, you can postpone things. You can have a small little get together somewhere outside where you're in the air. My sister just recently had to postpone her wedding once, and when we had her wedding, it was outside, so we tried to distance and keep our masks on. And um, even though it wasn't her dream wedding, it was still a good time. And we know we're going to get back once all this starts to die down and be able to celebrate together.
Yeah, I think it's just really important to keep the big picture in focus. And I think the other thing that we got to be sure our patients understand and our citizens understand is that what we're telling you right now may be different in a month from now. I'm telling, if anything, if we haven't learned anything else, we've learned that we can't. There's no gold standard for management of this issue. We do, if there is a gold standard, it's social distancing, masking, and washing your hands. But other than that, I don't know where it's going to go. It's like Chris mentioned treatments. I mean, there's a whole bunch of new treatments now, and we're much better at managing patients. I mean, I think if they had 2 deaths in Dallas yesterday and 460 cases. That's a significant drop. And the biggest thing that changed has been that the governor said you need to wear a mask. And I think you're seeing lots of stores say, if you're coming to our store, you're going to have to wear a mask. You're going to have to do those things. It's no different than I've got a heavy foot, and if I'm not careful, I find myself driving down the freeway at 85 or 90 miles an hour. Uh, I promise you, I may want to drive that way, but if I run into the right black and white, I'm probably going to get a ticket for doing that. And I don't expect it to be any different because we've decided certain speeds are where we ought to be for things, and that's in the best interest of our people. I don't see this as any different than that. And I think wearing a mask is just a sense of responsibility that we ought to be willing to get our arms around. Inconvenient, absolutely.
Absolutely.
But if it's in the middle of the night and I'm driving to Austin and there's nobody on the road, hey, what's wrong with me driving 95 or 100 miles an hour? Well, it just ain't in anybody's best interest, to be honest with you. And I think we got to look at that like this. That's what we're kind of dealing with as we go down this road. Uh, I want us to kind of visit just a little more about immunizations and vaccines. Because if we go back to school, there's always a focus on physical exams and toning up our kids and getting them immunized. So why don't we talk about that just a little bit? What sort of things need to be happening? You got a kiddo that's just starting to school. We need to get all those usual things done. So I mean, what are you guys seeing? You and Alice I know Chris, you and Alice are probably seeing more kids. Uh, Catch us up.
I think it's very important for people to remember with all of, COVID is all over the news. There's other diseases that are still happening. We saw the measles outbreak about 2 years ago,
Right.
all over Texas, which could have been easily preventable if patients were still coming in to get their vaccine. There's been a pertussis outbreak pretty recently. So this is a really good time for parents to bring their kids in to get them caught up on their vaccines. And our clinics are doing a really good job of making sure that the families are protected by having kids wear their mask and families wear their masks, frequent hand sanitization. Um, so I think that's going to be crucial, or we might see a big spike in some of these preventable illnesses.
If you guys have a patient that you think is a little sicker than the average patient that's coming in, or they've got an acute illness, how are you managing? What are you all doing?
Yeah, so we're doing some pretty heavy phone screening when our patients do call in, and so we have really a checklist, and honestly, it's annoying to our patients the amount of questions we ask them. But really and truly, if they come back with any acute illness, whether it's an upper respiratory thing or really anything that could mimic this COVID, we actually don't let them into the clinic. We actually have a spot set up. We're lucky enough to share some thoughts with Dr. Johnson, and we have a good system set up between us too. We're able to block off some areas. We're able to see patients in their car. Our nurses can call them on the phone, get all of their symptoms, and then as a physician, we can go out there and we can do any testing, whether it's a flu screen, a strep screen, or even a COVID screen. If we need to do something like that, we can go out there and do that with essentially limited contact with my staff, which protects not only the patient, but it also protects our staff. Um, and so, yeah, that's what we're doing right now. We're doing quite a bit of car visits, which also protects our well visits. Listen, we still have patients that need to come for blood
Right,
work. We have
exactly.
patients that they really do need a wellness exam, a in-person visit. And so with us using these protocols, we're able to protect our patients that really are high risk to get COVID, but really, we've been able to essentially divide our office outside and inside. Another thing that we were kind of talking about earlier is really utilizing telemedicine visits. I really don't feel like we've reached our potential for telemedicine visits. And so, anybody listening out there, if y'all have any questions or concerns, we all agree that there are some things that you need to go see the doctor for. However, there are also some things that, especially during this time, a telemedicine visit could really could take care of the entire visit, in my opinion, very adequately. And
Mhm.
so I think the underutilization of telemedicine visits is definitely there too. But I just don't want to use that as. But yes, people still need to come in clinic. There's still some good things about a good old physical exam that make a difference. But I think right now we've changed the entire way that I've been in practice here for 7 years, and we have two chairs in my entire waiting room now. You come into my office, you go straight to a room. There's no waiting in the waiting room anymore. There's no full waiting room with kids running around or anything like that. So really, this whole thing has changed the way we practice medicine. And I think technology has a lot to do with it. And I think we need to utilize telemedicine more. But I still think it's important to get those chronically ill patients in for appropriate blood work. So,
Chris, you seeing that? I mean,
Yeah, absolutely. We are all the positions in Henderson County are absolutely committed to keeping our office safe and creating an environment in our offices so that you can come into the office and feel like that you can do that safely. And so, we are committed to taking care of people that are sick that need to be seen. We just do it in a different way. And so, we see people out in the car, even though, I mean, to be honest with you, it is a significant commitment for the physician and our staff because we're gowning up into full PPE gear, and it's 102 degrees outside, and it's very
it's raining
uncomfortable.
today.
yeah,
Yeah,
raining.
or raining or whatever. And but our staff and the physicians are willing to do that so that we can take care of people and do it in a safe way. So we clean our exam rooms after every single patient, like a terminal clean, not a regular clean. And we keep people 6 feet away. We allow minimal patients in the hallways so that you're not exposed in the waiting room. So all those things are things that we're doing so that that our patients can come into the office and feel like that they can do so safely, and still take care of people that are sick and maybe they have COVID or maybe they have something else infectious. They still need to be taken care of too, and so we're doing that in a way that accomplishes both things.
Anybody having any trouble getting personal protective equipment? For a while we couldn't hardly get it, but it seems like we have an adequate amount now. Is everybody else seeing that? I know
Yes.
Yes,
the Texas Medical Association
has
was
been
really,
yeah,
they've been fantastic
Yes.
absolutely.
to help us get that equipment, and the governor's been very supportive. The state has has regionalized personal protective equipment. In fact, I think the last time I picked up for our group, I picked up for you guys too, and I think actually picking up some tomorrow afternoon again. And we've just been trying to keep all that going, and we've been very successful. And to the hospital's credit, they've been very collaborative in helping us too. They had some extra things we could use. They've worked with us. It's been a really good effort, I think, to kind of keep things moving in the right direction.
And the community's been phenomenal too. There's been so many people that have been donating masks to our clinics and to the hospital.
That's true. There have been people making masks at home and bringing them in, and that's always appreciated because we have patients that come to the office that don't have a mask, and so we give them a mask as soon as they get there and get them in that environment, and are glad to give them one that somebody's given us that they can take home and use and wash and tend to as is appropriate. Uh, I think that one of the other areas that is going to change our world over the next few months is what about a vaccine? Where are we with a COVID vaccine? We all know we've got to be sure these other immunizations are given. The last thing we need is a measles outbreak in the middle of this, or a whooping cough outbreak like we talked about. But what about the COVID vaccine? A lot of work, a lot of talk about it. I guess my biggest heartburn is that I'm hearing people saying I'm not going to take it. Uh, Tell me about what you all are hearing about the COVID vaccine.
Hearing a lot of different things about it. Um, I mean, for me though, like I tell my patients, like, listen, as soon as they get one FDA approved, I'll be the first in line to come get it, and and I hope they have a pediatric version so that both of my children can get it. And that will extend from my family there. Um, but yeah, I think it's gonna be very important for really anybody to get the COVID vaccine. I really do.
Yeah, absolutely. And what I am reading about the vaccine, the phase, they're now in phase three of the studies. The phase one and two data look very good. The side effect profile of the vaccine has been, um, pretty acceptable, and the efficacy of it, the data really looks good. And so I haven't really read anything negative. There's several vaccine candidates out there, and there's two companies that are really pretty far along with phase three. And I believe, Doug, you were saying there's a company that's just administered 30,000, plus administered 30,000 doses. And so hopefully we will have a vaccine by the end of the year. Is a really fast time, but that's what the goal is.
I think for us to really be able to manage this, we're going to have a vaccine. I mean, I don't think that we're going to be able to return to the reality of our lives as it is without having a vaccine, and or as they were before, because things are certainly different now than what we experienced before. But I worry about people taking the vaccine, uh, and I guess. I really struggle with how do we reassure people that these things are really safe and that they really do make a difference. I testified multiple times during the legislative session last time, and the people who opposed vaccinations, it was amazing. I don't have a good answer for how to communicate the safety and the efficacy of vaccines. I think probably the thing that changed medicine the most in my lifetime and just immediate before I began my career in medicine has been clean water, appropriate sanitation, and vaccines. Those three things have made more difference than antibiotics, more difference than coronary artery bypass surgery, than all the coronary artery disease we treat, and all the diabetes things that we can do now. I think those simple things have made the biggest difference, and probably vaccines more so maybe than anything else. I mean, the whooping cough issues that we had before we had a whooping cough vaccine. I mean, we had 400,000 kids die at a pop. I mean, it's just insane that we are hesitant, and we've got to somehow reassure people. And if you have concerns, for God's sakes, talk to your doctor, talk to other family people that you trust and have some sense of uh, comfort with, so that we really communicate about the safety and the efficacy of these vaccines. They change the world if we can do that. And I think as we look and begin the process of administering the COVID vaccine, uh, we cannot politicize this. We got to do what's right for our people, and that's to be sure that the vaccine is safe first and foremost. I think if you've heard anything from the people that are building this thing, they know that it has to be safe, and it has to do all the things that others have done. and it has to be as effective as all the others have been, or it destroys the whole vaccine world. So I think this is going to be a good, safe vaccine that we can trust and we can use. Uh, Anybody else have any heartburn about what they see coming with it?
I think leading by example is going to be really important. Um, it, to me, I think it's going to be kind of similar to how some people have their qualms about the flu vaccine. They don't want to get their flu vaccine because they're worried that it's going to cause them to get the flu. But if we as healthcare workers are going and getting our COVID vaccine and actively people are seeing that, then I feel like they'll be more comfortable to see that it's the same thing and that we're doing it because we truly believe in it.
And I do think that's important. It's just like, you know, of course, everybody in this room skinny except the old codger here. So, I mean, you guys, taking good care of yourself, it's just an example we ought to set for our patients. And I do think stepping up and doing it, like you, Jim Bob, you said about your family, you're going to be sure they get it quick. And that's how I felt. In fact, Dr. Meditol and I walk in the mornings together. We were talking the other morning because they were looking for the 30,000 volunteers. And Ted said, let's go, Doug. And I said, I'm in. Yeah. And we had the number, but they already had all they wanted. I mean, I think I would be very comfortable being in the trial. That would not frighten me at all. I know I know what great effort goes into getting these things done, and I'm very confident in the people that are giving of themselves to make this happen. So, if I can't, I mean, I just am I'm so excited. I think we'll have a vaccine, like you said, before the end of the year. I just hope people will take it and not be hesitant because uh, they work. They just make a difference. It changes the world.
Yeah, Doug, one thing that I just want to mention about the vaccine, none of the vaccine trials are using a weakened version of COVID-19. Okay, so it's not like it's a weakened version that can give you COVID. It's not like that
It's
at
a
all.
whole different
It's a,
vaccine.
it's a different vaccine using, something that's going to cause you to mount an immune response to the virus, but it doesn't have any of that virus in the vaccine. So, that gives it a measure of safety. It's not a live virus vaccine.
Yeah, it's the future. Don't you think of a lot of
Yes.
vaccines? I think we're going to see a bunch of things happen that work this way that are
Yeah,
going to really make a big difference in what's going on. Well, as do you think, or do you all see things as we move into fall and, like I said, football and some of those other things? What do you think is going to happen? Where do you think we'll be? Are we going to see another spike of COVID like we did around the 4th of July? Or what's going to happen as our kids go back to school? What do you think?
I wish I knew.
Yeah.
I'm just gonna answer that honestly. I do think though it's gonna make wintertime is a time where people are usually more sick, upper respiratory infections, bronchitis, pneumonias, things like that. And I think this is going to be a pretty trying year for us as we try to go ahead and start thinking about that time. What testing are we going to be able to do to rule out not only your strep throats, your influenza, but now we've got this COVID in the mix, and so I think it's for us it's going to be challenging. But from everybody that I've talked to here in Henderson County, I mean, I think the primary care providers are really up to this challenge to really get through this pretty easy, I think. Taking care of our patients appropriately, giving them the right treatments. I mean, when you look at what we've gone through with COVID so far, I feel like once we do finally get into the fall, we're going to know 2 to 3 times as much in terms of treatment, in terms of getting rapid testing, in terms of all this stuff. So I actually have a good outlook moving forward. Back to your question about what are the actual numbers going to look like, I really hope they're down. I really do.
Yeah, I hope that they're down too. I guess my biggest concern is how um, our offices are going to deal with the higher volume of sick patients that have infectious problems that you don't know. Because right now we're seeing a lot of those folks out in the car, but it's not efficient. So we're doing it that way for safety purposes, but I can't see as many people out in the parking lot as I can in rooms. So, you know, that's my biggest concern about how things are going to be in fall is how we're going to take care of the higher volume of infectious problems in an efficient way that gets people safe.
But I think the good news is, who would have thought we'd be doing what we're doing 6 months ago? I mean, we were all, just kind of rocking along, doing our usual routine, making sure everything was happening. And now we're doing things so much different than what we did before. And again, I think that one of the things that you mentioned earlier, telemedicine is going to offer us some great opportunities, especially as we see people this fall. You see somebody on a screen and you visit with them just a little bit, you get information, you're going to kind of get a hint of how sick they are. I think one of the things that you learn as a physician as you go along, you're able to recognize that sick patient. And that is strategic for us. And I think we do that well. So if we can do telemedicine, the caliber and the way it ought to be done, we may be able to filter this a little better than what we've done before. And I would encourage folks out there as they're purchasing insurance, as they're looking at plans this fall for Medicaid or Medicare Advantage and all the other things that are out there, be sure those plans include telemedicine and be sure they include your primary care physician in them. Because some of those are all fragmented. They do kind of things that you get lost in trying to save money, and you end up getting a product that is not of much value. And so, because realize the governor's requirement for payment for telemedicine goes away the 31st of July. So if that's not extended and we don't see some changes, that all goes away. So we've got to see that extended. I know the Texas Medical Association and a number of other community groups, community clinics have reached out to the governor and asked him to extend that into the end of September. And I really think that's important for that to happen because it'll help us get around our arms around healthcare. I think in that arena just a little better than what we have now because it's still in its infancy. And I don't know about you all, but it's pulled back some compared to what it was 2 months ago. 2 months ago, we were doing a lot of telemedicine visits. We're just not doing that as many now as we were, and I think we need to recapture those.
And I think the telemedicine visits help prevent patients from getting sick enough to where they get to that point where they need to go to the urgent care or the ER. And so if you can catch it up early and treat the patient, that's better care for your patient. And then you're also minimizing exposure to the COVID.
Risk is much less. There's
Yeah.
no doubt about that. Well, any kind of winding things up, any last comments about where we're headed, where we're going, what you think Henderson County needs to be doing over the next few weeks? Why don't we kind of make our way around? Chris, you want to start?
Yeah, my only comment really is to encourage everyone to have a sense of personal responsibility regarding the COVID-19, um, wearing your mask. If you've been exposed, to follow the guidelines on quarantining, which is 14 days if you've been exposed to someone that has it. And if you have it, then don't go to Walmart, don't go to the grocery store or something until your quarantine time is up, because you have a personal responsibility to not infect someone else if you've been exposed or if you haven't. And then the other comment that I would make in regards to our families and all is, just to watch out for those high risk populations. If you have an elderly person in your family, then do their shopping for them. Go to the post office, go to those places so that they don't have to, and they can stay home and be safe.
Yeah, I'm just going to second those comments there. I think taking a personal responsibility for this is going to be a way that we can hopefully curb this infection here in Henderson County.
I agree. Just everyone needs to remember we're all in this together. So it's going to take a team effort for us to flatten the curve and get back to normalcy.
But I think we're headed that way. I feel that we've learned so much about how to manage this. We're so much better at treating it than we were. Like Chris said, we're already using a lot of things in our hospital that's keeping it to a level that we don't have to push on toward a higher level of care. We're able to manage a lot of these people in our facility, and we're able to manage a lot of them on an outpatient basis, which is just fantastic. We're able to do that, and we couldn't have done that 3 months ago. I mean, we've made huge strides. So we're going to continue to do that. I think uh, uh, medicine's going to continue to build the things that it needs to do to protect our people, because that's what it's all about, is improving the health care of all our folks. And I think that's our commitment from the physicians in Henderson County. And we're all open to conversation. I would encourage you all to, as you have issues or concerns or questions, don't hesitate to reach out to us. We'll try to put some additional data available to our people on Henderson County now, some information that comes from the Texas Medical Association, some from Texas, and hopefully that'll answer some of your questions. If it stimulates other questions, we're available. And I know this group here, we're always open to a call or a conversation. Our offices are all here in town, so give us a holler. Thanks for the opportunity to visit with you. We'll look forward to.
I do have a couple questions.
Oh, got some questions. Oh,
I do
well,
have a
we'll
couple
take
of
those.
questions.
Let's go.
Okay, so first, there are a lot of numbers that come out, and sometimes they can be very confusing. So, as physicians in Henderson County, number one, are you seeing more illness in our county now than you were, say, 6 weeks ago? And number two, what numbers do you watch to tell you what's going
Well,
Go ahead, Chris.
I'll take that question. The of course, one of the main things that I look at is what's happening in my own personal patients, and the number of patients that test positive, that are calling and saying that they've been exposed to someone, or they have a coworker or a family member that has it. The number of patients, my personal patients that I've had to take care of in the hospital, has gone up a lot in the last month, but particularly in the last 3 weeks. And so it's not, so yes, we're testing more, but there's more infection in the community. So it's not just a matter of more testing being available. It's a matter of there being more sick people that requires the need to test them. So, as far as what do I look at, I look at the graph that shows how many daily cases there are, and that gives you a good trend to know sort of the direction for the county and also for the state. So that's the data that I look at.
on? So, see in the state.
Yeah, I mean, another thing that, and it's sometimes hard to get these numbers, but I look at the number of ICU beds that are utilized around the state of Texas. If you compare the number of ICU beds for the last 1 week this year, compare it to last year, there's a significant difference. And so that's a number that I look at, because those are the ones that are critically ill from this. And so yes, I look at the daily counts every morning, get a number, so you can kind of see what the trend is. I also agree. I'm testing more patients in our clinic, but also we're also having a lot more positive tests when you look at the percentages of the number of patients we're testing, the number that are coming positive, and that's right here in Athens, Henderson County, Athens. So
I don't think there's any doubt that that's definitely up. And I think part of the frustration that you're experiencing, Michael, especially in looking at numbers and data, is really a deficiency in our public health system. I think if we haven't seen anything else, we've shined a glaring light on our lack of public health capacity in our state and in our nation. And we have got to begin to look back at, okay, how do we do a better job of controlling things like this? Because this is not going to be our last. I mean, we're going to see some others come about, and they're going to come about very different than this one. I'm not predicting anything. I'm just saying I think viruses and other things are going to continue to plague us. We're not going to solve all this, and we're not going to fix it all. We're going to just continually be in a battle with it as to how do we manage it and how do we take care of things. And part of that is going to have to be a better public health system than what we've had. And we have to prepare for that. We put it on the back burner because it just isn't right there looking at us. And if you want to get something fixed in the United States, it needs to be on the front burner and a glaring problem and causing a lot of people a lot of grief, and then you'll get something done about it. Our ability to prepare and anticipate, we still struggle with a lot. And it's the old adage of, I want it and I want it right now. And I think that to do a good job in public health and to really make our country healthier, we've got to do a better job of preparing and planning and be willing to invest in that. And to this point, our country's just not been willing to invest in that. So it causes a lot of frustration. I do think some of the better websites that are out there, the Johns Hopkins site probably has the data that most people quote. So if you want to look at something that's really up to date and up to speed, I think the Hopkins website is outstanding. But I also think the data that's been coming from UT Northeast has been really good. And it's been really good and detailed for our communities. It shows Henderson County, it shows all the counties surrounding, and it shows the number of people that are in the hospital and are being managed. I think UT has done an outstanding job in communicating with physicians, giving us recommendations, collaborating with us to take good care of our people.
Thank you. That's great answers. A question for the moms in the county. So they're going to send their kids. Now I know that Athens ISD is going to do online for the next 3 weeks, and then they start early. But around the same time, all the kids will actually be physically in school. And we know mask up, social distance, and wash your hands. Okay. But then that child's going to come home and going to have a backpack and going to have stuff in the backpack. And so does mom need to disinfect all that stuff? Do we need to fog all that with Lysol? Do I need to take the kids and take them out of their clothes immediately and shove them in a shower? Are those things that parents should be worrying about as their kids come home from school?
I mean, I think that it's a good idea for trying to minimize the exposure of anything that the kid may have gotten on the bus or in the classroom, and having the kids leave the things outside, have it outside of the house. After a certain amount of time, the virus can't live on certain surfaces. So if you have your kids kind of just strip down and leave their belongings out, and then eventually spray it down, I think that's a perfectly good plan to try to minimize any exposure, especially if you have anyone, vulnerable people that live in the house that might become a lot more sick with the virus.
I don't know about you guys, but I got grandkids, and I'm amazed at what I find in their backpacks. I would encourage families to clean out those backpacks and be efficient with what you send the kid with, and just look at them. I mean, I'm amazed. I'm a look at my own briefcase. Frequently, I have to go through it and I find things I didn't realize I'd stuck in there. Sometimes keys and other things. But I just encourage you, it is time to kind of regroup as to how we do things. And as you send your kid off, you may want to be sure that you've got a minimal number of things in that backpack and then kind of go through and then come back and filter it, do the things you need to do to just be reasonable in caring for it. You don't need to be I think, a freak with all that, but you certainly need to be attentive to what's coming in and out of the house.
So in that same vein, masks. So we know we're supposed to be wearing masks, and let's say you have a family that's absolutely really being diligent in wearing their masks. But now I'm sending my kids to school with those masks and they're coming home. Do I need to have multiple masks, a mask for every day? Should I have enough masks so I can throw them in the washer? Do I need to be washing those masks daily? How often should I be doing that with those masks? I mean, I know the moms out there, do I need as many masks as I have pairs of underwear for my son?
I think that's a fair
Well,
question. I mean,
yeah.
I personally, I will frequently take mine off if I'm in my vehicle and put it up in the sun. I think that if you put it up where it gets some extra exposure, that's a good thing. And I think if you wear a cloth mask more than once or twice, it probably needs to go in the washing machine. And it needs to be washed with something pretty stout and, feel comfortable that it's cleaned appropriately. And I think disposable masks are just fine. And I'm not sure you should use them more than a day or two. And I think if you're going to use them a second day, like I said, they need air, they need exposure, they need sun because the droplets aren't going to live on them very long. But if you get them in the sun and other things, then I think that really does help.
So now is that sun or heat? I'm just curious. I mean, so for instance, and I'm just thinking of all the parents that are trying to do everything all at the same time, and we're giving them more stuff to do. So if I take a mask and I throw it in the dryer and turn on the dryer and hit it with a bunch of heat, am I good to go? No, not saying no.
I don't think so. I think if you're just going to throw it in the dryer, you've not done what you need to do. I think if you put it outside in the sun where there's a breeze and everything else, you've probably pretty well sanitized it.
How long would you do that for?
I don't have any data to say, but I think common sense should prevail in at least an hour or two.
Yeah, and I would agree. If you have a cloth mask, probably change that out every day. Have a fresh one every day. There's certainly data on this particular virus that it doesn't live on surfaces real well. So when it first happened, we weren't sure about that. It does live on surfaces. You could get it that way, but in general, that's not the primary mode. And in my patients that have gotten it, it's been mostly from a relative that came over that had it, or it's personal contact with a person that has it more so than um, touching a book or um, you know, opening up the mail or any of those surface things. So but yes, if you're using a disposable mask, throw it away, get a new one every day. If you have a cloth one, wash it every day and get enough that you have an adequate supply to do that.
Outstanding. Thank you very much. I know there's some questions kind of as we get back to school in the fall and we try to get things going that I know people are asking kind of questions that are being asked. So thank you.
Thanks, you guys. Appreciate it. All you docs for taking the time and hopefully been helpful for our people. And if we can help, let us know. And Michael, reach out to us at any time. Thank you for your time.
Yes, sir.
Thanks, you guys. Really appreciate you doing